Welcome to the Ellsworth County Medical Center's Patient Family Advisory Council's training module. Each of you should have your ECMC PFAC orientation manual in front of you. These are yours to keep. We hope you will use them often and bring them to each meeting. Today, we will briefly go over each section. They will cover what to expect as an advisor, ways to engage with others, how incidents and problems are covered at ECMC, plus more. This information will help you acquire PFAC knowledge outside of our monthly meetings. Remember, please bring your manual with you to each meeting. We will be including updates as we progress on our journey together improving ECMC healthcare. If you haven't already, please open your manuals to page 1, the table of contents. At this point, the manuals have 5 sections, an area for you to take notes or write questions, and 3 attachments to help you understand how our hospital handles information. As we progress, we expect to add more sections and attachments, so the table of contents page will also be changing. Becoming a patient family advisor, here at ECMC we understand that this process may be new to you, and it's important to us to help you be prepared. Today we will be going over the highlights of the manual to help you become more familiar with it, but please take the time to read through it thoroughly later. Becoming a patient family advisor is important. Your perspective has the power to help make real changes in healthcare and improve care experiences for others. As a healthcare organization seeking your help, there are things we promise to do for you: providing the training you will need to be an active member, provide resources and support, help you prepare for meetings by being available for questions or concerns. We will be open and receptive to your ideas or suggestions. We will also provide feedback to let you know how your ideas are contributing to our healthcare environment. In return, there are a few things we will also expect from you. You will support our ECMC mission and vision. You will attend orientation training. You will prepare for planned meetings by reading or reviewing materials provided. If unable to attend a meeting, you will contact us at least 24 hours in advance. You will actively participate in meetings and, of course, maintain confidentiality. As a patient family advisor, you may have access to sensitive healthcare information that must remain private. Maintaining privacy concerning sensitive healthcare information is not only the right thing to do, it is the law. We will be including HIPAA training along with your orientation PowerPoint and manual review. The time commitment for being a PFAC advisor is meetings 1 to 2 times monthly for approximately 1 hour. Attendance is of course important. We will only be able to hold a meeting if enough advisors are present. There may be material for you to review from time to time. We will make sure you receive them by mail or email, whichever you choose. Feedback from both advisors and staff will be an important part of this council. You will be expected to share your experiences and ideas. Afterwards, we will update you on how your input has helped the organization. Section 2 of your manual contains tips for being an engaged advisor. As you read through these tips on your own, make note of the things that might be challenging for you. Be sure to ask for help from our ECMC staff if more help is needed. All of the advice in this section is helpful, but 2 are especially important. Number 3 on page 7 about asking questions, and number 5 on page 8, tips on being a PFAC advisor. Read through this section on your own thoroughly, and remember, we are all available if you have any questions. Page 9 in your manual has a section on sharing your story. For some of you, this will be the most important part of being a PFAC member. Sharing your story can be a powerful way to show the need for specific changes and improvements here at ECMC. In this section, you will find guidelines for how to prepare yourself and your information before you share it. It will also give you an idea of who you may be asked to share it with. There is also a worksheet provided called Sharing Your Story to help you organize your thoughts prior to a presentation. As you are preparing for what you want to say, think about the following questions. Why was I asked to share my story? What are the key messages I want to share? What are 2 to 3 special points I want the audience to remember? What am I willing to share and what is too private to share? What examples can I give them when things went well and what could have gone better? What ideas do I have about my experience that could have been improved? The answers to those questions will help you as you fill out the worksheet, but also keep in mind these tips. Only share what you want to share. Be sure to focus on experience rather than individuals. Be prepared for emotional reactions to your story. And finally, remember that you are always in control. If people ask you a question and you do not know the answer, it's okay to say so. If you do not want to answer a question, that is okay as well. At ECMC, we want to make sure that everyone who comes to the hospital has the best experience possible. A huge part of your job as patient family advisor is to help give us feedback about your experiences, suggest changes and improvements. You can do that by participating in discussions, sharing ideas, helping create or revise instructional materials or projects, but most of all, by just sharing your stories and experiences. We at ECMC want to make sure that every patient who comes into the hospital gets good quality care. To us, this means that patients get the right care for their condition. They get tests and treatments that are recommended for their condition. They get care that is safe and free from medical errors. The tests and treatments they get do not cause them harm. Also, that there are no delays in care. Patients should always get the care they need when they need it. We want our patients to be treated the same, with no difference because of their race, ethnicity, income, level of education, or social status. We want our patients to get care that is patient and family-centered. Above all, we want to make sure that patient and families have good experiences and are supported while they are in our hospital. We welcome your thoughts and ideas about how to make sure all these things happen. Help us identify ways we can improve. One way to identify areas for improvement is to look at whether the right things happen as part of our patient's treatment. Do patients get the medicine they need when they're supposed to? Do they get the correct tests and treatments? Another important way to identify areas for improvement is to ask patients about their experiences. For example, many hospitals ask patients to fill out surveys about their experiences in the hospital. One survey that you may hear about as an advisor is called HCAHPS. Your manual has a bit more information about HCAHPS, and we urge you to study it. Next, in Section 4, there is How Things Work at ECMC. This section contains copies of our mission statement, our vision, and our values. ECMC is passionate about caring and educating our patients and improving lives. We're excited about your joining us. Section 4 also has a list of our hospital leaders. As a new member of our healthcare team, it's important for you to be familiar with the structure of Ellsworth County Medical Center's internal organization. At the end of the training manual, we also included three important documents: our organizational chart, our policy for risk management, and our risk management flow diagram. Please take the time to become familiar with this material. They will be valuable resources for you. And finally, Section 5, to learn more. This section contains a list of websites that has information about healthcare quality, patient safety, and being a patient and family advisor. I think you'll find them interesting and helpful. The notes page is the space included in our manual for you to take notes or write down any questions you may have. But remember, our staff is always available to help you. Now, it's time to begin your journey as an ECMC Patient Family Advisor. As we said before, we're excited to have you as members of our team. There has been a lot of information given to you as a start, but don't worry. We have every confidence that with a small amount of effort and commitment, our ECMC Patient Family Advisory Council will soon be seeing gratifying results. Welcome, and let's begin.